my name is Maryn and I'm a nursing student here at the University of South Alabama, and this is my medication administration video. Okay, so the first thing I'm going to do is I'm going to make sure I'm in a no interruption zone. I'm going to limit my conversation with colleagues unless it is essential information. I'm going to make sure all the doors are closed. I'm going to take no phone calls, and I'm also going to review the hospital's no interruption policy. Okay, so now I'm going to perform my hand hygiene. And the first thing I'm going to do is I'm going to compare the MAR form to the patient care form. So we have Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 417-6352, medical record number 417-6352. Okay, we also have allergy to penicillin. Over here it says allergy to penicillin. Okay, today we are giving him heparin 5,000 units subcutaneously every 12 hours. Over here it says we are giving him heparin 5,000 units subcutaneously every 12 hours. Okay, perfect. So now we are going to get rid of my patient care order form and only use the MAR form. Okay, so I'm going to perform my hand hygiene again because you never know. And I'm going to start my first check of the 7 rights. Okay, so right patient, Jaguar J. Jones, date of birth 8/25/1963, medical record number 417-6352, allergy penicillin. Okay, then we have, says right medication is heparin, so I'm going to bring out heparin. Okay, we have heparin right here and it is not expired. My phone has trouble focusing. Hopefully it focuses from farther back. Okay, heparin, 10,000 units per milliliter. It is not expired. It says expiration date is 12/5/2025, so I am good to use it. If it will focus, hopefully. Okay. I'm pretty sure it did. Okay. So right medication was the heparin, and we see we have that in my hands. I'm going to move this over this way so we can see. Okay. So right dose is 5,000 units. So we're gonna have to do some math. We have 10,000, so that'll be 0.5 units per milliliter, and I'm gonna verify that with another nurse. Right route is subcutaneously, so I'm going to be using my tuberculin safety syringe. Okay. Right time is every 12 hours, so I'm going to make sure that I don't do it before 12 hours. So I'm going to take my alcohol swab. I'm going to clean the vial. Throw it away. And now I'm going to draw up 0.5 units per milliliter of heparin. Okay, I'm going to make sure there are no air bubbles. We're going to flick it. Okay. And now I'm going to put the safety lock on it. But we see that we have 0.5 units per milliliter of heparin. There we go. There are no air bubbles. Okay. So we said the right time, right documentation is all elements of a legal prescription are included, and right indication is anticoagulant, and heparin is a anticoagulant. Okay, perfect. So now I am going to start my second check of the 7 rights. Okay, so right patient, Jaguar J. Jones, date of birth 8/25/1963, medical record number 4176352, allergy to penicillin, we've noted that. Okay, so right medication is heparin. We see that we drew up 0.5 units per milliliter in our syringe. And we'd also make sure that we verify that with another nurse. Subcutaneously, we saw that we used our TB syringe subcutaneously. And right time is every 12 hours. We're going to make sure that we do not give this before or after 12 hours. And the right route was subcutaneously. The right dose was 0.5 or 5,000 units. Okay, I said that. Okay, and then right time, right documentation is all elements of a legal prescription are included, and right indication is anticoagulant, and we know that heparin is the anticoagulant. Okay, so now we are going to make the label. So I'm gonna put heparin 5,000 units, Jaguar J. Jones. Okay. So now I'm going to put that on the end, and now we have our label made. This is heparin 5,000 units, and it also needs to say per milliliter. Okay, and then it says Jaguar J. Jones. Perfect. Okay, so now I'm going to go into the patient's room. I'm going to take the MAR form with me, the heparin vial with me, along with the injection. Okay. So now I'm going to the patient's room. I'm gonna knock. Hi, my name is Maryn. Today I'm gonna be your student nurse, and today I'm gonna be giving you heparin. Do you have any questions? No? Okay. So now I'm going to start. I'm gonna wash my hands, and I'm going to put on my gloves. Okay. So, we're going into the patient's room. Okay, perfect. And here's my sharps container. Okay, so we're in the patient's room. So the first I'm going to do is I'm going to start with my third check of accuracy of the 7 rights. Okay, so we have Jaguar J. Jones, and I'm also going to compare it to the patient's armband right here. So we have Jaguar J. Jones, date of birth 8/25/1963, medical date of birth 8/25/1963, medical record number 417-6352, medical record number 417-6352, allergy to penicillin. Okay, and I'm gonna ask Mr. Jones, do you have any other allergies I should know about? And then no. Okay, perfect. So now I'm going to wash my hands. Again, I'm going to apply a new pair of clean gloves. Okay. So that was the right patient. Right medication is heparin, and we see we have heparin right here. And we know that we have heparin drawn up in our syringe. Okay. Right dose, 5,000 units. We know we have the correct units. We have 5,000 units per milliliter. Okay. And we also have the right route subcutaneously, and we know we have the right syringe. Right time, every 12 hours, and Mr. Jones, it's been 12 hours since your last injection, so it's time to get another one. Right time, okay, so right documentation is all elements of a legal prescription are included, and right indication is anticoagulant, and we know that heparin is an anticoagulant. Okay, perfect. So I'm gonna lower the bed, raise the bed, lower the side rail, position the patient into a comfortable position. I'm going to look around the skin for any swelling, bruising, edema, anything like that. I'm going to palpate. And now I'm going to clean from the middle out. Without contaminating. Okay, leave that there. So now I'm going to since this is subcutaneous, I'm going to spread, and I am going to inject. Or I'm going to pinch, and I'm going to inject. Perfect. I'm going to dispose directly into the sharps container, and I'm going to gently hold, and I'm not going to aspirate. I'm going to gently hold lightly with light pressure. Okay. Then I'm going to discard my gloves and goggles. I'm going to lower the bed, raise the side rail. I'm going to perform my hand hygiene, and I would go and make sure that the patient does not have any reaction, any swelling, any type of bleeding, any type of adverse effect, and I'm going to go document how the patient tolerated the procedure or the injection and anything new that they noticed. And I would come back in about 15 to 20 minutes to monitor this injection site to make sure that everything looks normal. There's no swelling, new bruising, edema, or anything like that. Okay, and that concludes my medication administration video.